right now, in the middle of this pandemic, respiratory therapists are more in demand than they've ever been, and they are on the front lines working day in and day out. And these guys are highly specialized in their craft. Their training, their background, everything is centered around taking care of patients in some of the most detrimental times of their life, and they're very good at doing that. And I would like to think that our program has a part in that process.
We are looking for a science-minded person, usually very interested in getting into healthcare. And so we need someone who wants to be a problem solver and is curious. We want you to look at a patient and want to solve their problems with your specialized knowledge and skills. And so, science background, chemistry, microbiology, we work a lot with oxygen and gases in the hospital. And so that is a lot of flow and volume and pressure that we're using as we treat patients, and so physics is a big part of our profession. And so we're looking for just someone who is curious and wants to help people and solve their respiratory problems.
We put the student to bedside after their first semester in the professional portion of the program because they are in training. So we do classroom, we do lab, we do simulations, and they end up at bedside during their second semester in the program. What it comes down to is 2 years undergrad, they come to us, we're 6 semesters, and they graduate with a Bachelor's of Science in Cardiopulmonary Science. They're eligible to take their nationally recognized board exam and become licensed in any of the 50 states and Puerto Rico.
We have a cardiopulmonary science program that produces respiratory therapists. And so, they're trained to treat patients with pulmonary disease, and that is exactly what COVID-19 mostly is. Graduates from our program are out across this area and even across the nation giving respiratory care to patients.